Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/newwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. Good morning to everyone. Welcome to today's forum. The forum will start in 15 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/MuWebinarsYT. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram. The forum will start in 5 minutes.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this event is the UP-PGH Department of Obstetrics and Gynecology. This forum runs every second and or last Tuesday of the month from July 2021 to June 2022 and will deliver interactive medical lectures by prominent specialists here and abroad on common medical conditions and concerns relating to the female population. Physicians, nurses, and pharmacists may avail of CPD units. To receive email reminders to future webinars, please register at tinyurl.com/muwebreg2021. Registration is free and open to physicians, healthcare professionals, medical and allied medical students, and lay observers. For those interested in getting a certificate of attendance, please sign in the online attendance form to get a certificate. The links are in the description boxes of UPM Livestream and FB Live, and chat boxes of Zoom and YouTube. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step to receive your certificate of attendance. Make sure that your details are correct. We are now streaming on UP Manila Livestream, Zoom, Facebook Live at Mu Webinars, and YouTube at tinyurl.com/muwebinarsyt. If you are encountering any problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube and the Q&A chat box of Zoom and UPM Livestream. For healthcare professionals who want to avail of CPD units, a link to an online evaluation form will be provided at the end of the forum and will also be sent to your email address after the forum. Wait for the confirmation email up to 2 days after the event. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all vaccines available in the Philippines, and 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Additionally, we have installed a new set of immunity booster stickers on Viber and Telegram for your use when communicating with your loved ones through the aforementioned platforms. You may download them at tinyurl.com/immunityviber for Viber and at tinyurl.com/immunity-tg for Telegram.
God our Father, we come to you in our need to ask your protection against the COVID-19 virus that has claimed lives and has affected many. We pray for your grace for the people tasked with studying the nature and cause of this virus and its disease, and of stemming the tide of its transmission. Guide the hands and minds of medical experts that they may minister to the sick with competence and compassion, and of those governments and private agencies that must find cure and solution to this pandemic. We pray for those afflicted. May they be restored to health soon. Grant us the grace to work for the good of all and to help those in need. Grant this through our Lord Jesus Christ, your Son, who lives and reigns with you in the unity of the Holy Spirit, God, forever and ever. Amen. Mary, help of all Christians, pray for us. Saint Raphael the Archangel, pray for us. Saint Roch, pray for us. Saint Lorenzo Ruiz, pray for us. Saint Pedro Calungsod, pray for us.
Welcome to the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum. This event is brought to you by the Mu Sigma Phi Medical Sorority, UP College of Medicine, Philippine General Hospital, and the City of Manila.
The beneficiary of this
Pray for
event
us.
is
Saint
the
Lorenzo.
UP-PGH Department of Obstetrics and Gynecology. There will be a question and answer portion at the end of the discussion to be facilitated by our moderator. Type in your questions in the comment box of FB Live and YouTube, and the Q&A chat box of Zoom and UPM live stream.
The title of this forum is Ready, Get Set, Go Surgery. Tara na, maghanda para sa operasyon. Today's forum aims to tackle concerns regarding preparation and prevention of complications during surgery. For today's forum, we have Dr. Anna York Bondoc again, a pulmonary oncologist, surgical and medical intensive care physician, and a former congresswoman for Pampanga's 4th District.
Hello po and magandang tanghali sa inyong lahat. It's 12 noon and we are here for our second edition of Mula kay Doktora, the Doktora Julita Ramoso-Jalbuena Memorial Women's Health Forum. So welcome again, and kasama po natin the Mu Sigma Phi. We are sponsored of course by the Mu Sigma Phi Medical Sorority, the UP College of Medicine, the Philippine General Hospital, and the City of Manila. So I'm Dr. Anna York Bondoc, and tara, maghanda na po tayo sa inyong operasyon. So our second webinar is entitled Ready, Get Set, Go Surgery. Or tara na, maghanda po tayo sa operasyon. And we aim to discuss dito po yung preliminary requirements for a female patient to be the right candidate for surgery. Moreover, today's forum will also provide us with the proper way for patients to prepare po for gynecologic surgery and to conduct measures to ensure their safety. So to formally start this webinar, I am honored to introduce both our distinguished speaker and our equally distinguished reactor. So our first speaker will be Doktora Grace Herbosa of the UP College of Medicine class of 1993. Doktora Herbosa is currently a practicing cardiothoracic anesthesiologist in various hospitals, including the Philippine General Hospital, the Medical City, and St. Luke's Medical Center, Global City. She's also a professor and chair of the Department of Anesthesiology of the UP-PGH, UP College of Medicine. So Dr. Grace is also the better half of USEC and Vice President of UP, Dr. Ted Herbosa. And additionally, she's the mom of 3 beautiful daughters. It's really an honor to have an anesthesiologist join a webinar kasi usually nasa OR po sila. So I really am very much interested in her talk. So later on, we'll have Doktora Lilibeth and Ms. Jane Kingsu-Cheng to join us. But meanwhile, let us welcome Doktora Grace Ann Herbosa of the Mu Sigma Phi Medical Sorority Batch of 1983. Doktora Grace.
So magandang tanghali po sa inyong lahat. I'm Dr. Grace Herbosa and I have no disclosures related to this lecture. So it's a ready, get set, go surgery. Tara na, maghanda para sa operasyon. So we will be focusing this afternoon on the female patient as a candidate for surgery, her preoperative preparation, as well as measures to ensure safety perioperatively. Okay, as an anesthesiologist, I will orient you as to what happens with you during anesthesia. So most people think that with a flick of the switch, anesthesia just happens, and the gift of oblivion and the mystery of consciousness begins. Okay, so it's not as easy as that. Traditionally, we have been taught that anesthesia is defined by three pillars. That's unconsciousness or amnesia, analgesia, and muscle relaxation. And this has been called the triad of anesthesia. But we're in 2021, and anesthesia is much, much more complicated than that. It includes a myriad of pharmacologic agents, techniques, and monitoring. And monitoring goes from basic monitoring to advanced hemodynamic monitoring and spans the period preoperatively up to post-operative, as well as recovery, even up to 30 days after the operation. So let's look at general anesthesia. General anesthesia is not sleep as we know it is to be. It is actually a medically induced coma. And so as you go through or maybe prescribed surgery, there are ways to lower your risk. Because that's always a concern for the patient, including meeting your anesthesiologist. Okay, the female patient as the focus or candidate of surgery. Now, a woman, especially in a matriarchal society like the Philippines, engages with the healthcare system during different times of her life. In fact, she creates a relationship between the health system and her family, and is probably involved in medical decision-making processes for their families as well as for herself. And her views on the health system, particularly for surgical care, often stems from a positive childbirth experience. Now, a concern for most patients is pain management. Will I feel pain during the operation or after it? Now, there has been an introduction of several enhanced recovery protocols, or ERAs. It's enhanced recovery after a certain procedure that minimizes reliance on opioids. And this emphasizes patient recovery, early patient recovery, as well as safety. Now, female patients often undergo C-sections, gynecologic procedures, as well as breast procedures. As key demographic decision makers in the healthcare systems, we look at certain needs and barriers of the female patient. There are opportunities for optimization, implementation of an enhanced recovery program, and focusing on pain management, how to support positive outcomes, faster recovery, as well as improve patient experiences. Now, this is a survey done in the United States by Wakefield University, and it made two surveys. The first survey are among women patients, and the second survey is among the clinicians or practitioners. And as you can see, the key motivators that makes women want to recover faster and go home. In 43% of women, they are the primary caregivers, and they have responsibilities for children as well as for other family members. For 31%, they would like to get back to work faster. For 13%, they have concerns about contracting a secondary illness or infection. For 6% of these women, they probably have an upcoming event or trip. And for other reasons, for 7%. So there's really a big value on improving the surgical experience of our patients. And the first step is really all about patient education, especially among our Filipino patients. Now, for the PGH, we have what we call a preoperative assessment testing and education center, which is a preoperative clinic. It's nicknamed PATEC. And at the PATEC, what happens there? We try to manage patient expectations through counseling and education. We give them an overview of their experience, whether it's for anesthesia and surgery. They should be counseled on nutrition. They're provided with an overview of aftercare, the pain management, management of surgical drains, etc. And it's an opportunity to assuage any potential pain-related fears. Aside from that, in the PATEC, aside from getting or educating our patients, getting them fully informed, we look for the coexisting medical illnesses and advise them on lifestyle changes, whether it's smoking cessation, the drugs they've taken, or fasting guidelines. It is an opportunity to order diagnostic exams, including the COVID PCR test, and we estimate the level of risk. And more importantly than risk assessment is risk modification or optimization, so our patient gets ready for the surgery. Lastly is getting a consent, an informed consent, wherein we allow the patient to take part in the decision making of their procedure. Okay, it's also a time wherein we identify high risks for complications in the perioperative period. For example, for medications, if you have pulmonary hypertension or any pulmonary vascular disease, it is advised that you should continue your medications for pulmonary hypertension. For beta blockers, which is a common drug that's used for hypertension, and if you're a chronic beta blocker user, you have to continue your medication. If you have 3 risk factors like diabetes, coronary artery disease, heart failure, renal insufficiency, or strokes, it is wise to begin beta blockers. And if you have no other risk factors, it is of uncertain benefit. For statins, like Lipitor, etc., it is continued in patients currently taking statins chronically. It is important to start them if patients are going to undergo vascular surgery, and is considered in patients with undergoing elevated risk procedures. For angiotensin converting enzyme inhibitors or ACE inhibitors or ARBs or angiotensin receptor blockers, it's very important to consult with the anesthesiologist, because some studies will advise that we discontinue taking the ACE inhibitors and the ARBs the day of surgery or the night before surgery, because this can magnify hypotension as we give anesthesia. Then we also ask about antiplatelets, anticoagulants, herbal supplements, allergies, as well as pain medications of our patients. Now, functional status is another very important thing that we ask our patients, because it is a predictor of perioperative and long-term cardiac events. Okay. Now, METS, as it is called, is an estimate of how our patients can withstand cardiac events. So it is expressed, as I said, in metabolic equivalents, where 1 MET is the resting or basal oxygen consumption of a 40-year-old 70-kilogram man. Now, it's classified as excellent if you have more than 10 METs, good, moderate, or poor if it's less than 4 METs. As your clinician, I would like to hear a greater than 4 to 10 METs among our patients, meaning the patient is able to climb a few stairs, can walk on level ground at 6 kilometers per hour, they can run short distances, they can do heavy household chores, or can do highly strenuous sports. Now, if you're just resting and reading, watching television, that's a very poor MET score. I mentioned earlier the enhanced recovery after surgery protocols that has been suggested, and this is worldwide. And in the Philippines, we have started to implement ERAS. These are evidence-based aspects of perioperative care to accelerate patient recovery. It standardizes perioperative management, and achieves a reproducible improvement in the quality of care. Now, this is an example of the ERAS protocol for C-sections at the Philippine General Hospital. It includes pre-admission information, education, and counseling. It includes preoperative optimization and risk assessment, wherein smoking and alcohol cessation is advised. And if you have a risk that needs rehabilitations, then we refer you to rehab. We advise on nutritional care, whether underweight, overweight, obese, or diabetic, and manage anemia. This goes on by identifying patients who are high risk for nausea and vomiting, because this can become a problem for patients post-operatively, and goes on through intra-op care for antimicrobial prophylaxis, skin preparation, fluid management intraoperatively, fasting prior to OR, and many things, and many other things, including anesthetic techniques, surgical techniques, hypothermia, and surgical access. So as clinicians for perioperative care, we would like to expedite recovery because this is more critical than ever. And it really is a process that starts preoperatively with risk assessment and risk modification, intra-op management, whether it's lung protective ventilation, using minimally invasive surgery, moderate fluid management, low-dose muscle relaxant use, opioid-sparing approaches, and using neuraxial anesthesia, to post-op care, giving attention to pain management, your respiratory complications, achieving a early mobilization amongst our patients. And as I mentioned earlier, risk modification is very important. Now, this has to undergo a local review because, more importantly, from just extracting guidelines from abroad and bringing it to the local level, we have to assess the efficacy of our local algorithms and to localize all these guidelines and get optimum results for our patients. So in a nutshell, we took up why a female patient is an important patient and a different patient, the importance of preoperative assessment, risk stratification, risk modification, the process of consent, as well as patient participation in decision-making. So again, anesthesia is not sleep as we know it. It is a medically induced coma. So thank you. And I'd just like to end with this picture that our emphasis is really patient safety. As you can see in the 1900s, the playground wasn't really safe at that time. So apparently then, only the strong survived recess. So now with seeing more critically ill patients, we try our best to give quality care and to give reproducible outcomes and ensure patient safety for all our patients. Thank you and magandang tanghali po sa inyong lahat.
Thank you so much, Dr. Grace. Ang ganda ng usapan. And not many people know a lot about anesthesia. So this is something very interesting to know about. So I failed to mention this earlier. We are welcoming questions po from the audience. Please put them in the comments section if you are listening to us on FB Live. And promise, we will do our best to read all of the questions, though talagang inuulan na po tayo. So thanks so much again, Dr. Grace. And now we move on to our second speaker. Our second speaker is Dr. Lilibeth Siasu of the UP College of Medicine class of 1985. Dr. Siasu is currently a practicing gynecologic oncologist in PGH, where she's also a professor and serves as a mentor to future gynecologic surgeons and also to future doctors among the MUSES. Personal note, Dr. Siasu was the ACR when I was an intern and talagang noon pa man. Bilib na po ako sa kanya. It's an honor to meet her. Ang bait pala niya. So without further ado, let's call on our very own. She's a gynecologic oncologist, Dr. Lilibeth Siasu of the Mu Sigma Phi Sorority batch of 1985. Ma'am, it's an honor to have you.
Good day, everyone. I would like to thank the Mu Sigma Phi Sorority and UPPGH for this opportunity. I have nothing to disclose. In December of 2019, the SARS-CoV-2 emerged from Wuhan, China, and spread around the world. In March 11, 2020, the WHO declared the COVID-19 as a global pandemic. This resulted in lockdowns and curfews, leading to suspension of less essential aspects of healthcare and caused disruptions and delays in elective work and surgeries. The health service had to adjust to the challenges posed by the pandemic, as there were concerns on the safety of performing diagnostic gynecologic services as well as surgeries. Following the declaration of the pandemic, there were cancellations of elective surgeries in hospitals in order to optimize medical resources for emergency cases, and most of the staff were redeployed to attend to critical care units. Several guidelines and protocols were issued for best practices, and from time to time, several changes and adjustments have to be made. These can be downloaded from their websites. Remodeling of services have to be made, such as telephone triage-based system for consultation, virtual consultation through video calls and telephone calls, and telemedicine for follow-up and post-operative reviews. All patients were encouraged to do teleconsultation. A system of waitlisting of patients was set up for prioritization and validation of cases. When a patient consults, a shared decision approach was adopted, which is highly encouraged. It is centered on patient preferences and values. Cases were classified according to risk and urgency of procedures. Emergency cases are those needing surgery within the hour. Urgent cases are those that can be addressed within 24 hours. Elective urgent within 2 weeks. Essential elective in 2 weeks to 3 months. And non-essential elective procedures include infertility procedures and family planning procedures such as bilateral tubal ligation. We follow this risk stratification in scheduling patients for surgery. The preoperative evaluation and preparation for gynecologic surgery pre-pandemic and during the pandemic are basically similar, and the addition of RT-PCR testing prior to admission. In some hospitals, an admission chest X-ray is being required. A detailed history taking, including medical comorbidities, should be obtained. Mandatory complete physical examination should be performed. Laboratory examinations pertinent for the case are requested. A pregnancy test should likewise be done on a reproductive age woman, especially if she has to undergo pelvic surgery, because you would not want to do a hysterectomy with a missed pregnancy in situ. Testing for genital tract infections to minimize vaginal cuff infections is also recommended on women undergoing hysterectomy. Proper referrals to subspecialties are required. RT-PCR testing is mandatory prior to admission, which was initially admissible for 7 days and then 5 days, and now the HICU has reduced it to 3 days prior to admission, and all patients requiring emergency procedures are managed as probable COVID if their COVID test results are not yet available. Alternative treatment options, risks and benefits of the procedure are discussed thoroughly. For example, a patient with procedentia uteri may be better off with a pessary rather than by vaginal hysterectomy with suspension procedures. Even cancer patients are advised neoadjuvant treatment while awaiting for their OR schedules, whenever allowed. Following testing, all patients are instructed to self-isolate at home until they are admitted. Patients who tested positive were deferred for at least 14 days from the onset of symptoms, and retesting as well as clearance is done based on local policies. The perioperative SARS-CoV-2 infection increases post-operative mortality, and in a review of 140,231 patients, the 30-day mortality of patients without COVID was 1.4%. The timing of surgery following COVID-19 infection is important. The 30-day mortality is 9.1% if surgery is performed within 2 weeks of SARS-CoV-2 infection. And it goes down to 2% if surgery is performed beyond 7 weeks following SARS-CoV-2 infection. The adjusted 30 days mortality in patients with a preoperative SARS-CoV-2 diagnosis was increased in patients having surgery within 0 to 2 weeks, at 3 to 4 weeks, and 5 to 6 weeks of the diagnosis. Surgery performed to more than or equal to 7 weeks after SARS-CoV-2 diagnosis was associated with a similar mortality risk to baseline. However, patients with ongoing symptoms, even after a delay of more than or equal to 7 weeks, were shown to have a higher mortality if their symptoms have already resolved or when they are asymptomatic. Whenever possible, surgery should be delayed for at least 7 weeks following SARS-CoV-2 infection, and patients with ongoing symptoms even after 7 weeks from diagnosis may benefit from further delay. The gynecologic services of our institution during the pre-pandemic used to cater to about 20 elective gynecologic cases per week, but were drastically reduced to half or to 1/3 due to the pandemic. So much so that we have to prioritize cases which will benefit most from surgery, such as prioritizing early-stage endometrial carcinoma over advanced stages. In 2019, we had 834 cases operated electively, and for the first 6 months of this year, we only have 248 cases. When the facility declares that the ICU complex is full, and when the preoperative evaluation reveals a need for post-operative ICU care, these cases are rescheduled until such time when they can be accommodated. The expected duration and recovery period are also thoroughly reviewed. The preoperative preparation include issues that are addressed in the clinics and even prior to surgery or in the operating room, and this would include medication management and blood loss preparations. We have to practice patient safety at all times and minimize or prevent a wrong person, wrong site, or wrong procedure done on the patient. Cessation of smoking is recommended, as smoking increases the risk for post-operative pulmonary complications. Interventions for surgical site infection prevention includes a timely administration of effective pre-operative antibiotics and practice of meticulous operative techniques. The risk of venous thromboembolism is significantly increased during and after surgery. Thromboprophylaxis reduces the incidence, and the decisions regarding the method, dose, and timing of prophylaxis depends on the patient's risk of thrombosis versus perioperative bleeding. We use this table to score the patient's risk of bleeding complications. These other issues should be addressed adequately. In difficult surgeries, the most senior and experienced surgeon is tasked to do the procedure, or assist trainees in the performance of the surgeries. On admission, COVID-19 precautionary measures should always be practiced. Reassessment of symptoms such as headache, body ache, loss of taste and smell, stomach ache, diarrhea, vomiting, sore throat and chills, fever, shortness of breath, fatigue, cough, difficulty of breathing, and chest pain are monitored and reassessed. Proper PPE should be used at all instances. Surgeons engaged in aerosol-generating procedures of suspected or confirmed COVID-19 patients should use the appropriate PPE, which include an N95 mask or of higher standard, a fluid repellent sealed well-fitted long gown, double gloves, apron, full face shield or goggles or visor, scrub hat, and disposable shoe covers or dedicated closed footwear. The hospital has separate pathways for elective and non-elective patients as well as for COVID and non-COVID patients to protect both the patient and personnel. It is important always to establish a safety culture to prevent errors. With this new surge of COVID-19 cases, let us adjust and adopt. Being a member of the hospital services arm, we would like to encourage everyone to get vaccinated so that we can reduce the complications of COVID infection, especially among those undergoing surgery. We should follow the best practice guidelines and embody safety measures to achieve good outcomes. Thank you.
Salamat po, Doktora Lilibeth. This is one of the most interesting discussions that I have heard this year because most of us are focused po, lalo na kami, medicine, we're focused on COVID-19, but this is the first summary that I have seen on the impact of COVID-19 on surgery, especially gynecologic surgery. Ang ganda po ng discussion. So today, now, we will have our reactor naman po. And again, you have the opportunity to ask questions. Please put them lang po sa comments. We will pick them up along the way. So right now, we have our reactor to give her insights and reactions on preparations for surgery. We have Miss Jane Kingsu-Cheng. Jane is a mom of 3 who loves DIY. Ako rin, mahilig sa DIY. So from cooking, baking, to creating anything from scratch, she tries to squeeze in small pockets of learning with her 3 kids as much as she can. Apart from being a mom, Miss Jane is also the sub-editor and a columnist of the Manila Bulletin Lifestyle and editor-in-chief of Wedding Essentials. She's also worked in ABS-CBN Publishing for 10 years, where she's had the positions of being liaison editor of Chalk Magazine to editor-in-chief of various publications like Pink, Chris Aquino, and Working Mom Magazine. Miss Jane is also one of the people who launched Forever 21 in the Philippines, where she served as the marketing manager. So to share with us her insights today, Miss Jane Kingsu-Cheng. Miss Jane.
Hi, Doc. Alam ng mga moms na hilig sa DIY. So yeah, as mentioned, I'm a mom of 3. So that actually I've been a mom for over 12 years. So that means my parents and all the seniors in the family are also getting older. This also means that I'll be facing possible surgeries in the future, both for me, but knock on wood, and also for the rest of the family, right? We've seen it. We've seen our parents. Actually, we've seen our moms, our grandmothers. Tayo, like what Dr. Herbosa mentioned, tayo talaga mga moms and female talaga ang nagtitake charge when it comes to decision making in the family in terms of healthcare. So I totally appreciate this talk because it's also preparing me for what will happen in the future. And then I remember also before when my mom had her surgery to have her uterus taken out, and then my grandma had breast cancer as well. We were all there. It was 3 generations of women watching out for each other. Parang moms talaga ang nandyan sa hospital more than the dads, more than the men. Parang mas sila yung takutin in my experience and my personal experience. It's really the moms who are stronger. And I appreciate that this talk will help me in my decision making in the future. So what I love about this talk is it's been very informative. We've tackled pre, during, post, even recovery, because that whole experience could be long. It's not that short. Kasi even recovery. And then there are so many concerns because, to be honest, I've never had any surgery except for one. I did ligation after my third baby. So dun lang talaga ako nagka-operation na close to CS. And that's where I felt the pain and the medications nga that I had to take. Dun lang ako nakarelate with all the surgeries that my family has been through as well. So there are a lot of issues that I think I've never personally experienced that I need to know because of this talk that will help me. And now that we are going through a pandemic, mas marami pang issues involved. Like, do I really have to take surgery? Bakit kailangan ngayon? Can I prolong it pa? Because I don't want to go to the hospital right now. I see that a lot I hear that a lot in the conversations, even between me and my husband, though we're not going through surgery, not any one of us now in the family, but even as simple as having your medical exam there, parang ayaw nakakatakot. But like what Doktora Sia Su mentioned, ang daming precautionary measures naman yung hospitals. And I think the most important thing is really to trust our doctors and to keep asking questions until all your anxieties have been taken away, because that's the only time you can really trust the healthcare system. So which leads us to the next set of the program, which is to ask questions. I think I can start first. My question would be for both doctors, because I've seen this also when I accompany my grandparents, my mom. They're really very anxious on if they should go through with it, how to handle it. Like me as someone who supports, and also me as a patient. Docs, how do you handle the anxiety issues here?
Okay, should I take that? This is Grace Herbosa.
Sige. Thank you so much, Miss Jane, for your insights, especially yung family insights mo. And siguro kick off na po natin yung Q&A with the first question from Miss Jane. But meanwhile, before you answer, Dr. Grace, for the audience, please put your questions po sa comments. We will pick them up. So, sige, Dr. Grace, please pick up the question. I guess how do we deal with anxiety sa mga relatives, sa mga pasyente, at lalo na ngayon na napaka-anxious na panahon itong COVID-19?
Okay, I think anxiety is best addressed preoperatively as we go through whether it's a teleconsultation or a face-to-face, consultation. So, and the best answer to that is really education. Now, education kasi spans varied populations. No? If you speak to a patient who has gone through an internet Google search or so, then you have to address this. I have a problem with...
Naririnig po kayo.
Okay. So, if you address a patient who has done a Google search, then sometimes you have to answer all the queries and either validate it and just educate them well. The problem really is when you deal with low income populations and they have they have concepts that we have to change culturally. Like, for example, if you have a grandmother who says, Doktora, pwede bang ang schedule ng ating operasyon ay gabi kasi tulog ako? Yung parang gano'n, but you'll be surprised, but we get reactions like that as well, no? Plus, there are also patients who do not wish to listen to our the way we educate them. They'll say, ayaw nila marinig yun kasi bahala na kayo. Parang ganyan. So we have to deal with this individually. It's all personalized. And if you see that your patient is overly anxious, whether it's for the operation, fear of pain, then we have to alert the anesthesiologist who will take care of the patient, because then they'll be probably needing more medications post-operatively. So a pre-operative visit makes up a large percent of the preparedness of the patient. So it is best that you always talk to your anesthesiologist. I know for some people we're invisible, but I'd like to inform everybody that we are not invisible, and we probably we make up a most important part of your surgery. Kasi whether you like it or not, your life is in our hands, and it's really a privilege and an honor as you give your consent to us, that you trust us to take care of you. Okay? Kasi that's what anesthesia does. We're supposed to be in control of all your physiology to be able to make surgery happen. Thank you.
Thank you, Doktora Grace. Ang ganda nung sinabi nyo, lalo na yung sinabi nyo po na anesthesiologists are not invisible. Pupuntahan natin yan mamaya. Okay. So, Doktora Lilibeth, paano nyo pakakalmahin nyo yung mga pasyente nyo? Kasi nakakanervous na nga ho talaga, or anxiety-provoking is the word surgery alone. Tapos, dagdagan pa ho natin ang cancer surgery. Then, dagdagan pa ho natin during that pandemic. So, talagang parang atakihin na ho yung mga tao. What would you advise po?
Well, it's very important to do very comprehensive counseling for these patients. First of all, we have to explain the necessity of the procedure, the risk and benefits associated with surgery, as well as the anesthesia. And we have to address expectations of our patients and relatives as well. We have to go far beyond that, not only during surgery and immediate surgery, but we also have to discuss about the outcomes and future of our patients, especially very young patients who undergo cancer surgery. No? Kung ano yung kanilang survival rates, maybe we can discuss that already, even pre-operatively. But we should not scare our patients off. We have to be very factual regarding all of this, everything that we have to say to our patients pre-operatively. So all of these things, I think, natatakot nga, lahat naman natatakot na surgery. Kahit pa ilang stitches lang yan, takot tayo di ba? What more for major cancer surgeries?
You know, even doctors are scared of their own surgeries. Okay?
Mas lalo pa po yung mga doctor.
Yes.
Kasi alam po nila yung mga pwedeng mangyari.
True.
Okay. Thanks so much, Doktora Lilibeth. So, in the hands of Doktora Grace and Doktora Lilibeth, kahit po may pandemic, I assure you, you will be safe. Okay. Doktora Lilibeth, ito po para sa inyo. I was struck by this chart that showed na bumaba talaga ang elective surgery ngayong pandemic na to. Considering that you're a gynecologic surgeon, hindi ba po emergency lahat ng cancer? And can you guide patients on this issue? Opo. Okay. And I was also struck with how do you prioritize cases that will benefit ngayon po ang pandemic?
Okay, first question. Hindi lahat ng cancer kailangan ng operasyon. There are several cases that we can do. Can you hear me? Can I be heard?
Yes, malinaw po.
There are several cancers that can be addressed with surgery, and there are some others that can be addressed through chemotherapy or radiotherapy. No? During this pandemic, it is the striking difference there pre-pandemic was that during the pre-pandemic period, we can just do our surgeries left and right, even for the advanced stages, because we have the ICU for our post-operative care. But during the pandemic, hindi lang Personnel ang limited. Pati yung hospital, OR rooms are also very limited. So before, we used to have 4 or 5 cases every day for just our service alone. We were left with 4 or 5 in a week during the pandemic. So much so that we have to stratify. Yung emergency, syempre, lahat ng emergency o operahan. Lahat ng urgent, kailangan i-prepare for operation. But for the electives, we have to choose. How do we choose? We have to choose with regards to the prognosis of the patient. For example, for the example that I gave, for early stage endometrial carcinoma, even the early stage endometrial carcinoma does not have an equal footing for surgical urgency, no? Yung mga patients with low grade, good histology are put in first. They're operated in first because the prognosis is greatly improved when surgery is done. Those with poorer histologies, medyo hindi naman kasi na-affect yung kanilang prognosis even after surgery, then they can be dealt with neoadjuvant treatment. Like, for example, giving them chemotherapy or radiotherapy first before they can actually be scheduled for surgery. Those patients who really need ICU care, talagang dependent yan sa availability ng ICU sa hospital. Pag sinabi ng team, wala ng bed for ICU care, lahat ng pasyente pre-operatively na kailangan operahan, na kailangan ng ICU care, postpone kayo lahat. And then we resort to neoadjuvant treatment first. So that's the impact of COVID among our patients.
Thanks, Doktora Lilibeth. Very telling talaga yung nangyari po nitong COVID na ito. And how do you prioritize po that will benefit? May listahan ho ba kayo ng mga non-emergent at emergent surgeries?
Yes, may listahan ng emergent and emergent. At the start, we had an ad hoc committee, surgery ang team leader noon. So they had a listing, no? This is based also on international on an international standard kung sino yung dapat unahin sa surgery. All patients who would benefit from surgery the most are the first ones in line. And those, kung let's say surgery will afford no advantage in their prognosis, might be the last in the priority.
Thank you, Dr. Lilibeth. I'm familiar with triage sa ICU as an ICU physician, triage sa ER. Pero may triage din po pala sa surgery. And that's very interesting to know about. Thank you so much. Dr. Grace, ito po. Kayo na po ang nagbanggit that some anesthesiologists are invisible. How can we, and then napapansin ko, lalo na kung minsan, it's the nurse na lang who does the consent form. How do we change this culture na kung minsan hindi mo man makausap yung anesthesiologist mo, they're like nagmamadali all the time. How do we make an anesthesiologist less invisible? And how will we help our patients? Oo.
Okay. That's a change in the specialty, but the only way to sell our profession is really to be involved, and really come out of our shell. So slowly, I think that's coming. We educate our trainees about this because slowly we're also becoming a litigious society, and I think it's very important that our patients know who we are because it gives us credibility and they understand our role in a surgery. I think we've always been on the background, but I don't know why it is so, but I really feel that that's really a problem with the specialty. And this is not just in the Philippines, this is worldwide. Another thing kasi is the introduction of group practice. Because of group practice, it's either your group should be very involved in preoperative explanation and seeing our patients and explaining to them who is actually attending to them. Another thing, sometimes, yun nga, yung mga anesthesiologists nga, kasalanan nila talaga na hindi nila na-explain, nakikita ang patient pre-op. And that's why the concept of the patient is that parang ano lang kami gamot, di ba? Ang anesthesia ay just gamot, walang tao. What they don't know is the role nga of us controlling physiology for surgery to happen. That is a specialty problem. And I guess patients can demand to see the patient, the anesthesiologist, even just before the operation. So like me personally, I try my best to talk to the patients. Since I do cardiovascular anesthesia, I think it's a little different because it's more risky as an operation. So we make it a point to explain the risks to the patient. At the same time, assure them that we are there to care for them. And we'll always be there every second of the operation until the early post-operative hours of recovery. So it's a specialty problem. Thank you.
Ayan. Thank you, Dr. Grace. I have a lot of respect for anesthesiologists, having worked closely with them. Sana mas maging involved sila kasi makakatulong talaga yan sa mga pasyente.
That's true.
Makakatulong.
That's true.
I'd like to let everyone know, inuulan po tayo ng tanong, so short answers lang po.
Okay.
Okay, Miss Jane, you have another question.
Yeah.
Oo,
Can
please.
Can I ask Dr. CSO, possible ba now with COVID kasi ang daming ng takot rin? Well, possible bang outpatient? And the other question is related to it. Some naman in the US, after operation, within the same day, pinapalakad na, parang okay na, hindi na kailangan magpahinga. So, what is applicable here in our country and what type of operations ang pwede?
We do have outpatient procedures, no? Meron talagang ginagawang on outpatient basis lang. So, papasok ang pasyente ng alas 7, uwi din siya after a few hours when the procedures finish and they are stable enough and fit enough to go home. For patients who cannot be done on an outpatient basis, we encourage early discharge. So about 1 to 2 days, kung pwede na yung pasyente, pwede na rin pinapauwi. Personally, all our patients sa gynecology, kung physically fit to undergo surgery, then physically fit to stand, mobilize right after surgery. Hindi na uso yung 2 days, 3 days na nakahiga lang yung pasyente. In the past, sasabihin niya ng mga matatandang pasyente, 1 week kami pinapahiga sa hospital, doktora. Ay, hindi na po uso yan. First day pa lang, nakatayo na kayo dapat. Naglalakad na. Pati nga sa pagliligo, allowed kayo maligo. Hindi na yung takot kayo sa tubig, kung ano-ano dyan. We tell these patients, we tell them. So OPD procedures, we do them, but limited then. And the early discharges, early mobilization and discharge.
Ayan. May second question ka ba, Miss Jane, or okay na?
I think Dr. Grace was raising her hand. Meron ba?
I just wanted to add that this is what we call the Enhanced Recovery After Surgery Program, which is really a group of protocols that we do. And it starts from pre-op preparation. The fasting period has been shortened to reduce the catabolic state right after surgery. And then we use shorter acting anesthetics, neuraxial anesthesia. All of this is focused to improve or enhance the recovery after. So we use even prehabilitation, pre-op, para we teach them that they should stand already right away. And aside from physical prehabilitation, there's also psychological prehabilitation, meaning we explain to them the expected outcomes after, diba? Para alam nila, naintindihan nila, hindi sila nawawala. That was important is cognitive dysfunction. We take that so much we take that into consideration with anesthesia and the recovery as well. Thank you.
Ayan. Ayan. Ms. Jane, yes.
Sorry,
Nakamute ka
yes.
ata, Ms. Jane.
Addressed to the both of you, since we're talking about surgery and as soon as possible you can go out, go home, outpatient. What are the issues that we have to watch out for? Since after post-surgery, wala nang healthcare professional with you. What do you have to be alerted on at home just to make sure everything goes well post-surgery?
Depends on what type of surgery the patient has undergone through, no? Syempre, lahat ito discussed pre-operatively. Kagaya ng wound care, fever, discharges, especially from wounds. Okay? And then, siguro, yung sa anesthesia effects, kung sumasakit ang ulo, what to do at home kapag sumakit yung ulo 24, 48 hours after surgery. So we tell them what to expect and what to do next. Okay? Yung mga long-term on follow-up, pwede na rin yun dinidiscuss na naman. Not necessary. We do them pre-operatively, but we tell them again post-operatively to remind them.
Ayan. Thanks, Doktora Lilibeth. Thanks, Ms. Jane. Ito from from one of the audience, from Mr. Al Nacional actually. Is it true that surgeons are afraid to do surgery because of the pandemic? Well, I'm a doctor. I'm even afraid to go to the ER. Sige, Doktora Lilibeth, go.
That's the perception, no, that doctors are afraid to do surgeries dahil nga sa exposure sa COVID. But the more we understand about COVID and the more we know on how to take precaution, on how to avoid the infection, lalong mas marami ng doctors ang gumagawa ng mga trabaho nila. And there are more surgeons doing this. We have so many PPEs, no? We are instructed on the proper donning and doffing of PPEs. So I don't think aayawan kayo kung kailangan talaga na i-attend kayo during surgery.
Yes, the more we know, the more precautions that we can take. Ayan, tama yon. And the better that we can advise our patients also. Ito, parang common question ito to Doktora Grace. And since you mentioned cognition, totoo po ba na nagiging makakalimutin ang mga pasyente after manganak or after anesthesia?
Okay, ang cognitive dysfunction kasi was never really proven. So they only found associations. Most of the studies were done on animals. Okay, why does this happen? Anesthesia is all about giving medications that has to interfere with brain function. And of course, this has effects on the brain depending on the neuroplasticity of the brain or how it recovers after. Among animals, they found that given short-term anesthesia, meron siyang long-term effects, no? So, which is, again, temporary for some. So we always think of going through surgery and anesthesia as an inflammatory process. Surgery and anesthesia invokes, parang there's some amount of inflammation that happens, and there is a prothrombotic reaction as well, meaning you become hypercoagulable, meaning mas pwedeng mag-coagulate yung blood. So maraming risks na nangyayari. Ang cognitive dysfunction, we have a risk scale. So alam namin preoperatively if this patient is prone to a cognitive dysfunction or even delirium post-op. And because of that, we have to taper our medications. We choose our medications wisely. At the same time, we have a monitor for the brain, so we don't put the anesthetic depth really deep. Kailangan, meron kaming numbers na tinitignan, meron kaming titignan ng mga EEG waves as well, if your patient is prone to cognitive dysfunction. This is supposed to lessen delirium post-op and hopefully not affect memory and all. But again, this has not been proven, hindi siya robust yung evidence. Kasi nga, it's about the brain. And as you all know, pag women, especially, we have a lot of hormonal changes that happens, progesterone, estrogen, oxytocins that increases after cesarean deliveries. So this all affects the brain. At the same time, you have sleep disorders, you have stress there. So all of this plays a part, no, in the recovery cognitively sa pasyente. So,
Ayan. Thank you so much, Doktora Grace.
thanks.
One thing I wanted to ask, which actually talagang naibahan ako sa webinar na to kasi ngayon lang talaga nag-usap ang anesthesia and surgery. Question, Dr. Lilibeth, you mentioned kasi group practice, which is common sa US and taking off dito sa Pilipinas. What is your take? Kasi dati may mga surgeon na may partner silang anesthesia kasi hindi mo na pwedeng hiwalayin yun no matter what. Merong iba naman, I've seen so many interactions sa OR, some of which are not mentionable talaga sa isang webinar. Ano? But what is your take? I mean, then how about patients who demand na yung pinsan nila ay anesthesiologist? Paano yun?
Group practice has taken off very well, I think, with anesthesia, not with surgery. Kasi
oo naman,
ang culture ng ating mga pasyente, gusto nila kung sino yung kausap nilang siruhano, siya rin yung gagawa. Ang first question nga, Doc, kayo po ba ang gagawa? Eh kapag sinagot mo, hindi, ay lilipat na lang ako. Kasi gusto ko kayo talaga ang gagawa. Pero sa anesthesia, it has worked very well. And in fact, I think even the scheduling of the anesthesiologists doing group practice has worked very well for us, surgeons. Laging merong anesthesiologists whenever you'll have an emergency or any other surgery. Laging meron kasi may group sila. Meron tao talaga na if-feel nila for your surgery. I don't know with Dr. Grace.
Yeah. I've been in several group practices. Some are more successful than others in certain things. So, but the way I look at it is really positive. One, you have schedules. One, you share expertise. If you need help, you help each other. There's always an anesthesiologist on board, whether it's an emergency, whether it's pay or charity, because we cover everything. And it's also a learning process kasi you learn from each other as consultants. What else? Maybe the only setback is that some surgeons will prefer a certain anesthesiologist at a certain, in the beginning, but we tackle this by first, the choice anesthesiologist will accompany the duty anesthesiologist and slowly, introduce themselves, and then I think it works well. It works well as long it's talagang teamwork. Tapos if for example, you're a general anesthesiologist and you need a critical care, you just call for help and they come. So as Lilibeth has said, group practices work very well for anesthesia. Maybe because we don't also own our patients ourselves, so it works well.
Okay. Thank you so much. Ang ganda ng usapan. Thank you so much kasi we refer patients for surgery and then hindi talaga namin alam yung mga interactions sa OR kasi hanggang dun lang kami. So magandang usapan. It also teaches how things work. Miss Jane, may last question ka ata. Ang daming tanong but few ang mga question.
There's actually two combined ko from the audience. Which is more preferred for pre-op patients, a 10-day self-home quarantine or admissions as probable COVID case, or just an RT-PCR done 3 days prior to admission or even longer prior to admission or shorter? Tatlong options.
Ano yan? Before admission?
Yes, before admission. How do we handle the pre?
Pre-operatively, ganito kasi nangyari sa aming hospital. PGH in particular, the HICO has already sent out its new recommendation, which means magpa-RT-PCR ka ngayon, kapag negative ka, good for 3 days lang yung RT-PCR result mo. In the meantime, habang nag-RT-PCR ka, kailangan nag-self-isolate ka rin sa bahay. Kasi you might get infection when you go out. Again, even after your
Totoo naman.
RT-PCR. Okay? So, combination of everything. I think that's our hospital policy right now.
Right.
Back to you.
Ayan. Salamat. Thank you. One of the last question na siguro ito, since naubusan na tayo ng oras. Sa inyo pong dalawa, you didn't mention, we mentioned a lot about comorbidities. How about age? Ano po yung oldest na operahan nyo? And how does age and kasi mention niyo rin po yung yung METs, yung functional capacity. But people are now getting living fuller lives as they get older.
Right.
And parang hindi na nila, lalo na kung early stage yung cancer nila, or even may nakikita pa nga ako mga 90 years old, talagang gusto nila maoperahan dahil gusto nilang humaba yung buhay nila. Any thoughts, Doktora Grace and Doktora Lilibeth, on age?
Age is always a consideration, no? So, but we've done coronary bypass graft surgeries in 90-year-olds, close to 100, as long as their metabolic equivalents are high. So, with all this kasi together, we're also able to deliver, anesthesia kasi has become really safe na now. Our anesthetics are so much safer now. We have better dynamic monitors that we can use. And even the surgical techniques are so much better now. We have minimally invasive surgery, robotics. Tapos we go into multidisciplinary discussions with each other as well as with the family. Basta everything should be laid down and everything, it's really education amongst the whole team. And so we're ready for the patient. So age is really not a contraindication as long as we think that it will improve the quality of life of the patient. Now, that's how I look at it. And everybody deserves a chance, di ba? If they consent to it. Thank you.
And I fully agree.
Maganda, Doktora Lilibeth, kayo, lalo na sa cancer surgery, and age.
Yeah, I fully agree with what Doktora Grace Herbosa has mentioned earlier. With regards treatment options, kung mag-consent yung patient through the risk of extended surgeries, then we go through with our surgery. Age will not be a factor, and if they are fit to undergo surgery. Otherwise, they can be given other alternative treatment options. Hindi alternative treatment as in non-medical. Yung alternative treatment like chemotherapy or radiotherapy or targeted immunotherapy or the treatment that we have on hand for our cancer patients. We do discuss these things with our patients. But generally age, I have operated on an 89-year-old for past, wala namang problem. Back to you, Anna.
Okay. Siguro, aside from patient and family education, kailangan din ng internist education kasi merong iba sa internist pa lang, natatakot na. Maganda yung pagkasabi niyo po that anesthesia has really moved forward.
Yeah.
And marami talagang development. Sometimes, hindi nakaka-scale sa mga general physicians. Sila yung unang nakakakita ng pasyente, agad-agad sasabihin nila, umuwi ka na or hindi ka na pwede. And that attitude should be discouraged. Ano po?
That's true.
Few comments na lang from...
Okay.
Sige po. Doktora Grace, go.
No, I just wanted to say that anesthesia, our monitoring has really advanced. No, we do physiology, we can see physiology in action intraoperatively now, and we have what we call dynamic monitors. Baka iba kasi yung internists, they don't see this in their institutions. So we really are in control of many things now in anesthesia. Of course, it's not perfect, but it's so much safer now in anesthesia. Okay, so. And among anesthesiologists, I'd like to encourage them also to learn all these new techniques, whether it's ultrasound, whether it's advanced hemodynamic monitoring. Kasi it's all there na. Tapos globally, the information is globally available virtually. So let's all learn together as physicians.
Ayan. Thank you so much. And I'd like to read this comment from Ana Marie Teresa Abaya. Si Ami Flora ito eh. At kaklase ko to Doktora Herbosa and Doktora Siasu. I really appreciate it when my anesthesiologist partner makes the effort to visit our patients before and after their surgical procedure. Thank you for trying the invisible culture of anesthesia. From Dr. Ami Flora Abaya, OB-GYN MU 93. Ayan. So, Dr. Grace, gusto niyo mag-react doon? Oo, dapat.
Yeah, I'm just so happy that they recognize na us, and slowly we're getting out of our shells as well. And we're truly what we call perioperative physicians. No, we're equal to the internists inside the operating room, and I'm very proud that among anesthesiologists at the Philippine General Hospital, we've gained the trust of a lot of our internists, cardiologists, pulmonologists to take care of our patients in the operating room, and they've seen also how we've progressed, and hopefully we can cascade this nationwide. Thanks.
Ayan. Ito na lang, promise, last question na from me. Okay. Marami naman hong nagagalit na surgeons, and tell me this, Dr. Lilibeth, kasi ang dami daw hinihingi ng anesthesia. Ang bata-bata pa raw, pinai-echo. Any thoughts? And second, last, promise na last. Bakit bawal kumain? Ang dami nag-aaway dito. Pakilinaw na lang.
Bawal yung sa mga hinihingi na pre-operative.
Yeah, like yung fasting before surgery. Kasi yun, ako, the internist, talagang halos galit na galit yung mga nagte-text sa akin. So, pakilinaw lang po. Kasi people keep asking, pwede ho bang uminom ng kahit katiting na tubig? Yung iba naman ho, So, pakilinaw lang. Siguro sa Doktora Grace.
For fasting,
yung first question po.
What do you want? Naku muna ba?
Yeah.
Fasting
Sige, kayo po.
Fasting has been changed already, the guidelines. You can have clear liquids 2 hours, up to 2 hours before surgery. A heavy fatty meal is 8 hours. A light meal is 6 hours. So, and if we have problems with fasting, all we do is do an ultrasound, a gastric ultrasound, to check if there's still food sa stomach ng pasyente. So it's not that difficult now. So, but fasting is important because ayaw nating sumuka ang pasyente during induction of anesthesia. And when I say sumuka, they can aspirate because they've lost their consciousness, and the food can travel to the respiratory system, to the bronchial tree, and this is really a disaster if that happens. Lilibeth, it's yours.
We allow our patients to eat as what Grace has said, yung clear liquids to at least 2 hours. Pero for major surgeries, we would probably want an NPO of at least 6 hours.
Right. That's right.
So back to you, Anna.
Okay, thank you so much po for this very interesting discussion. First time ko talagang to meet an anesthesiologist and surgeon together to talk about the OR process. Ang ganda. Thank you so much for sa lahat ng nagtanong. Ms. Jane, last words of encouragement sa mga natatakot na laypersons. Anong masasabi niyong tatlo?
Well, ako kasi I think I'm lucky because my family believes in surgery, and I have a brother who's a doctor. So iba yung environment ko. But I think the most important, especially for those na low-income families, it's really about educating yourself and trusting the doctor. So huwag kang mahiya magtanong hanggang masagot lahat ng concerns because buhay mo ang nakasalalay. So that's my advice to everyone. Our lives are dependent, and we really have to trust our doctors.
Yan. Dr. Lilibeth, kayo po.
Okay, I would just like to remind everyone that what is very important is doing a proper pre-operative and intraoperative assessment so that we can always achieve good surgical outcomes, and we address all of the problems pre-operatively. Okay, We also would like to practice universal health care precautions, especially now. COVID, additional precaution pa rin yan. Okay, and we should always do practice, put it into our culture. Yung patient safety should be embodied in our practices and in our hospital practices as well. I would like to encourage everyone again to get your vaccination para gumanda-ganda naman ang ating outcome during surgeries.
Yes, thank you so much, Doktora Lilibeth. Doktora Grace, kayo po.
Naman, I look at fear as something good. There should be some amount of fear every time we undergo a procedure, no? So, and that holds true for both anesthesiologist or physician as well as with the patient. So it's just the spectrum of fear. Siguro if it's just too much, then we have to control it. But it should always be there kasi nga it keeps us on our toes as well as anesthesiologists and keeps us vigilant. And not just, it keeps our senses alive at the same time. And as Lilibeth had said, that let's just take care of each other. If something happens, because we cannot guarantee 100% success in everything we do. As the human being kasi is different, no? So we should always understand the risk. Something can happen, and we're not like God, so we're not in control of everything. So something can happen because, our systems can malfunction as well. So, as a team, a surgeon, anesthesiologist, our nursing staff, let's just work together and take care of each other, watch over each other, and help each other if something goes wrong. Lang po.
Yeah, and thank you so much to these accomplished women and accomplished surgeons. Thank you also, Ms. Jane, for joining us. Sa akin po, ang na-pick up ko, no, if you need to have surgery, kahit may COVID, wala tayong magagawa, kailangan mong magpa-opera. However, a proper assessment, kasi mabuting ang malaman at ayusin yung mga problema bago nasa gitna tayo ng OR at doon natin malaman lahat. But aside from the proper assessment, kailangan din po ng proper communication and management po ng expectations. As Doktora Grace said, we are not God, but we will do our best to get you through your surgery safely. So sa inyo po lahat, thanks so much for joining us. We, the MU webinar team of the Mu Sigma Phi Medical Sorority, would like to express gratitude to our partners, the UP College of Medicine, ito po, the Philippine General Hospital, the City of Manila, and this event would also not be possible without our co-presenter, In Life, She Rose, and our co-sponsor, MSD or Merck Sharp Doom, and our official media partners, salamat po, Our Awesome Planet. We would also are grateful for the unwavering support. Maraming salamat po to the UP Manila Information Management Systems and the UP Manila Postgraduate Institute of Medicine. Most of all, maraming salamat po sa mga nakinig at nanood ngayon hong panahon ng lunch. Thanks for spending your lunch hour with us. Again, we would like to remind all healthcare professionals who are interested in obtaining CPD units. Sa mga naghahanap po ng CPD, please fill out the evaluation form at tinyurl.com. New webinars 2021 eval within 3 days after the forum. You may find the links to the evaluation forms at the comments box of FB Live, YouTube, at yung chat box po ng Zoom. Thank you also sa lahat po ng nakinig, and we'd like to invite you to join us for the next leg, third na po ito, MUla kay Doktora, Dr. Julita Ramoso-Jalbuena Women's Health Forum on September 14, 2021, Tuesday din po uli, from 12 to 1 p.m., entitled Post-Surgery Care Focus on Infection Prevention or Pag-alaga sa Bagong Operada. Paano iwasan ang mga infeksyon, which will tackle prevention and management of the post-surgical complications. Our speakers will be Dr. Angela Bandola and Dr. Butch Manalastas, and to be moderated by Dr. Apple Taladtad. We will also be having Miss Eileen Dreyfus, a PR consultant, as our reactor. So sa inyo pong lahat, thank you so much. Please support and participate in our year-long Women's Health Forum series. Maraming salamat po and magandang hapon po sa inyong lahat.
Thank you for attending the MUla kay Doktora, the Dr. Julita Ramoso-Jalbuena Memorial Women's Health Forum.
The MU webinar team of the Mu Sigma Phi Medical Sorority would like to thank our partners, the UP College of Medicine, Philippine General Hospital,